All right, let's get started because I know we have a lot to cover today. Welcome to the Texas Epidemic Public Health Institute Grand Rounds. The topic today is GIS for public health. But first, I want to tell you a little bit about TEPHI. We are a state agency here in Texas, housed at UT Health Houston School of Public Health, and are committed to keeping Texans safe and the economy strong by strengthening the capacity and resiliency of Texans to respond to future infectious disease outbreaks. As I mentioned, we are housed within UT Health, and we have a lot of partnerships. We can't do this by ourselves. Obviously, a lot of our partnerships are with governmental agencies, particularly public health agencies, but as well professional associations, business entities, other academic institutions, and community organizations. I want to let you all know, if you haven't heard about this yet, that we do have a certificate program in pandemic preparedness and response. There are 4 asynchronous courses, so you can do them whenever you have time. If that's 3 in the morning, they're there for you. And then it ends with a tabletop exercise, which is web-based but synchronous. The 4 courses are Fundamentals of Epidemiology. As an epidemiologist, I feel that you need to know a little bit about epi if you're going to talk about pandemics. Then Foundations of Infectious Diseases to learn something about agents that may cause outbreaks. Surveillance of infectious diseases, how do we tell what's out there, what's causing disease? And bringing those 3 basic courses together is the final course, Public Health Emergency Preparedness and Response. And as I mentioned, that has a tabletop exercise at the end of it. There is no cost for Texas residents, and we do offer a wide variety of CE credits if you need that for your certification. So if you are interested in this, go to TEPHI.texas.com. You can see here the online courses. We provide other webinars and trainings. These grand rounds are every 2 months. There is a summit coming up on October 19th about wastewater surveillance. And this is both in person in Houston as well as virtual. I forgot to mention about the online courses. Besides our certificate course, we also offer some mini courses. Coming soon are going to be ones on One Health, on basic data analysis, and on risk communication. These are 1.5 hour courses. They stand alone, but if they're an area that you're interested in, and keep checking because we have more coming up. Some webinar housekeeping. If you need closed captioning, click on the live transcript button. There is a question and answer box to ask a question, and I'll be collating those and asking at the end of the talk today. There's a chat feature if you want to just put in comments, reactions, intros. There's a survey we ask you to complete upon the end of this survey. And this webinar is being recorded. It'll be mailed out in about a week and also posted on the TEPHI website. If you want to see it again or you want to tell a colleague how wonderful it was and they should watch it. So I am delighted to introduce today Dr. Esty Garrity. She is our the chief medical officer for the company Esri, which she's going to tell you about what they do in the area of GIS. She is the chief medical officer at Esri, where she leads strategy and messaging for health and human services. She's helped organizations around the world use location intelligence to combat Zika virus, finish the fight against polio, grapple with the opioid crisis, address homelessness, enhance preparedness and respond, optimize healthcare access, and traverse the COVID-19 pandemic while tackling underlying inequality in all of these issues. She was formerly the deputy director of the Center for Health Statistics and Informatics at the California Department of Public Health, and she led the state vital records and informatics programs. She was also associate professor of internal medicine at UC Davis, where she conducted research using the geographic approach. Besides her degree in medicine, medical informatics, and in addition to her degree in medicine, she has degrees in medical informatics and public health. She's a board certified public health professional and a GIS professional. In 2021, Dr. Garrity was named one of the most influential women in health IT. And I have to tell you a funny, I guess, story about how I met her. Last April, we were both at the preparedness summit that CDC puts on in Atlanta. We happened to be sitting at the same table, got talking, and when she told me what she did, I said, "Oh, you would be great for our grand rounds." And she has kindly offered to do this. So please welcome Dr. Garrity talking about GIS today.
Thank you very much.
Oh, I forgot to say this part. Yeah, if you have questions, enter them in the Q&A box. Sorry.
And please do. Thank you so much. That was such a nice introduction. And hello to everybody. I really appreciate being invited to chat at Grand Rounds today. And we're diving into the world of geographic information systems, or GIS for short, as it relates to public health. And this is a vast topic. So we're just going to be zoning in on how GIS can have a real and tangible impact on public health initiatives. Now, for the next 40 minutes or so, I'm going to try to demystify GIS for any of you who don't know much about it, discuss its role in understanding communities, and highlight its significance in health equity. After all of that, then I'm going to walk you through some examples, especially from pandemic response, followed by a bunch of resources then that those who are interested can use to dig in a bit deeper. And yes, there will still be time for your questions at the end. So first off, what is GIS? Well, at its core, GIS helps us view, collect, and manage geographic information. It lets us analyze how places relate to one another. Think of it as any information system, but geography powered. And Nick Santos from UC Merced says that GIS helps us ask where things are and how they relate to each other. So let's kind of unpack that a little bit. As you begin to practice this idea of spatial thinking and the geographic approach, you might start by just asking a simple question about where are things located in the world. And when you put things in geographic space, it brings them into immediate perspective. So think about locations of buildings like hospitals or public health program sites. What about the importance of where we observe environmental sensors, people, video cams, images, or even tweets? I mean, finding out where all of these things are in real time can be very useful. And actually, once you know where things are, you start asking about their surroundings. This gentleman named Waldo Tobler from UC Santa Barbara said, "Everything is related to everything else, but near things are more related than distant things." This concept, spatial autocorrelation, really shines a light on how proximity influences factors like climate change effects, access to health facilities, or disease transmission in dense areas. Finding out what's nearby can help bring context to dynamic situations and deepen one's understanding of a location. And real-world connections matter. Take air pollution, for instance. Understanding how sources like cars or factories connect with environmental contexts help us predict which communities might be more affected and who might be more vulnerable. This interconnected view is why systems thinking is invaluable today. Knowing where, the near what, and the how it connects empowers you to act decisively. It's a part of a system, and when it's impacted, you can trace its effects and start to predict the future challenges that you're going to face. And this really helps in faster service restoration and overall recovery. And this holistic view is dubbed by Esri the science of where, and it really helps us pinpoint problems, monitor changes, and strategize resource allocation. And, fun fact, the word where ranks 110th in common English usage. It pops up more than you'd think. Now, beyond just what is where, geography also asks, why is it there? And why should I care? And that last one really leads us to actionable insights, driving efficiencies and positive change. I mean, these questions, as it turns out, actually encapsulate the essence of geography, which is all about understanding people, places, and their interactions. But why is the geographic approach essential? Well, as highlighted by both Hippocrates and the US CDC, location plays a pivotal role in our health and well-being. Think of it like this. We often zoom in on the microscopic, but sometimes a broader telescopic view provides the full picture. Merging both of those gives us a holistic understanding of health contexts. And research shows that 80% of our health outcomes come from our surroundings, our socioeconomic conditions, environments, and behaviors. I mean, context matters. And this really emphasizes the importance of our communities. I mean, they shape the contexts that have such a profound effect on our health. After all, even though our communities can't curb our cravings, they can craft the choices available to us. And they might not dictate the color of our eyes, but they undeniably influence how we perceive and engage with the world. When thinking about health and well-being, sometimes our address reveals more than our DNA. Let's ponder this for a moment. What's the initial step for a diabetic needing their medications? Possibly it's securing transportation to go and pick them up. Well, we can tap into American Community Survey data to pinpoint areas where vehicle access is scant. And maybe it's not the will to eat better that's scarce, but rather access to grocery stores with fresh, wholesome selections may be out of reach for some. With today's technology, determining if grocery stores are within a quick drive from a community is pretty straightforward. And while every neighborhood may not be able to boast a state-of-the-art gym, the presence of simple sidewalks can boost the well-being of its residents. People need safe places to walk, and several cities have mapped street safety in detail. Imagine this. It's not uncommon for doctors to advise patients to exercise more. I have done this millions of times. Yet in doing so, I might overlook that a patient's reality could be walking beside bustling roads, exposing them to potential harm or polluted air. Health advice must be context aware to really be actionable. Now, I mentioned Hippocrates before, and centuries ago, he asserted that the surroundings in which we live greatly influence our health. And this age-old wisdom underscores the role of GIS in promoting health. Now, in slightly more recent history, we'll go to the mid-1800s, a German physician, Dr. Rudolf Virchow, was, in my opinion, exceptionally insightful. Now remember, this quotation that I'm about to read came before we had a formalized public health system. So he was really speaking directly to clinicians, and he recognized a significant need, which in the end turns out to be the establishment of public health. He said, if medicine is to fulfill her great task, then she must enter the political and social life. Do we not always find the diseases of the populace traceable to defects in society? If disease is an expression of individual life under unfavorable circumstance, then epidemics must be indicative of mass disturbances. He advocated for physicians to get involved in politics and social reform to improve health. Essentially, he advocated for the role of public health and ongoing analysis of the social determinants of health. Now, around the same time, British philanthropist Charles Booth employed maps to scrutinize the relation between poverty and its impact in London. His visual depictions of stark disparities inspired him to advocate for societal change. So the bond between location and health has been acknowledged for millennia. The relationship of place to health inequities has been articulated for close to 200 years. GIS technology has been around since the 1960s. So, why hasn't this technology been center stage for addressing health inequities a long time ago? Well, I personally believe that it's a matter of the advancement of technology. Until now, I really don't think it could have stood up to the scale and actually the complexity of such a broad and multifactorial problem. And because it is such a broad and multifactorial problem, I'm going to say that a few times fast, we can really benefit from a framework to help us actually create equity, to go beyond understanding and create it. And in actuality, both the problem and the solutions in health equity reach across all of these structurally linked areas to create a range of experiences and outcomes for people in different communities. And I think it's pretty natural in our effort to understand our communities to find ourselves focusing on outcomes when we think about inequities. I mean, we commonly look at issues like disparities in chronic health conditions, infant mortality rates and birth outcomes, and access to care. But it's important, and in fact, a best practice to recognize the relationship between disparities in outcomes and disparities in the community conditions that contribute to those outcomes. And this is really part of what I've been leading up to in my comments so far. Communities are important, but we can go a step further. We know that inequities in outcomes and community conditions flow from decisions and practices that happen further upstream. This three-part model, by the way, was heavily influenced by the work of King County, Washington, and an organization called Race Forward, and I wanted to be sure to acknowledge their great work. So let me describe the components of this model in a bit more detail. Outcomes are the indicators of how people are faring. That is how individuals, families, and communities fare socially and economically. Outcomes, of course, include things like educational attainment and school attrition, prevalence and severity of chronic disease, and many other social and economic results that you are well familiar with. Community conditions are the circumstances surrounding individuals, families, and communities where they live, work, and play. Community conditions include circumstances like access to quality healthcare, to education, and to parks and recreation. It includes housing and environmental conditions, and many other conditions across a wide range of concerns. And then decisions and practices are the policies, the programs, systems, and budget decisions that influence the circumstances surrounding individuals, families, and communities, impacting how they fare. And these include historic and contemporary practices and decisions that have happened by governments, businesses, and communities. So decisions and practices can create or sustain structural racism and other forms of discrimination, bias against or for people based on class, gender, or other social groupings, inequitable distributions of resources or power, or intergenerational inequities, meaning really any combination of what I just said that has been impacting multiple generations of families or communities over time. So this model helps us to understand and address the root causes of social inequities, including racial injustice and health inequities. Now let's overlay this understanding with another equity-focused framework on health outcomes. And indeed, we are navigating to the social determinants of health, acknowledging the multitude of factors at play, like quality and accessibility of education or economic stability. The social determinants of health align very well with equity and social justice best practices for root cause analysis. As we know, the determinants themselves largely reflect community conditions that exist where people live, work, and play. And so they really live in the middle of this three-part model. And this also gets to another key point of my talk today, which is recognizing that using the social determinants of health as your proxy model for identifying community conditions that impact health outcomes, this is incredibly useful, but it's not sufficient by itself. I really want to stress that we should remember that all of this is also influenced by those upstream decisions and practices, and we need to understand those if we're going to achieve long-term and sustainable change. So I'd like to just briefly run through this model using a study from Charlotte, North Carolina, that was performed by an organization called Clean Air Carolina. And the study highlights a priority area around the center of Charlotte. And it turns out that the residents in this area tend to have higher rates of negative health outcomes, including behavioral health risks like smoking and obesity, chronic conditions like high blood pressure and diabetes, and higher rates of death. There also appear to be disparities in several of the community conditions, including exposures to toxins. In the social determinants of health model, you might have thought about this if you were searching for the causal factors based on neighborhood and built environment parameters. So here's the disparity. The historic West End of Charlotte, a predominantly Black community, has a disproportionately higher concentration of factories, waste sites, truck stops, and other large emitters of harmful air pollution. Now, looking upstream to decisions and practices, we learn that Charlotte has a history of segregation and redlining. People in the historic West End live with a long-standing legacy of industrial zoning and highway construction. Time and again, large sources of air pollution were cited in or near this community, which, by the way, had less wealth and political power to be able to fight back. And the high concentration of nearby air polluting sources also reduced property values in the community, essentially locking residents into homes that they now could not afford to sell. So I hope you get the idea of how you can apply the health equity lens and this framework with the social determinants of health and a broad view beyond outcomes to community conditions and then decisions and practices that may have created or supported them to improve health equity. So taking this broad view is a key step to fully understanding the root causes of inequities. And by the way, if you're wondering what happened with the folks in the historic West End of Charlotte, North Carolina, well, they used GIS in every step of the process. That included using maps to lead community education, developing partnerships with local schools, distributing air quality instruments where they were needed most, and establishing their own official air quality monitoring station. They also leveraged their work to go upstream to advocate for policy change. In fact, there was one high school student who presented mapped data to his school administrators, and he was able to get a new bus idling policy at his school. So maybe up to this point, you are still thinking of GIS technology as being about just making maps, but hopefully the story from North Carolina showed you a much broader use of the technology. And this slide is meant to further expand your perspective a little bit. GIS technology offers tools to support entire workflows, from collecting data and visualizing it to analyzing relevant factors and modeling various scenarios. And then you can design interventions, prioritize and make decisions, and monitor progress by evaluating change over space and time. And here's my one sort of technical slide to show a little bit about how the system works. Many of you may already be familiar with desktop software like ArcMap or ArcGIS Pro, and that software is truly a powerhouse for detailed mapping and analysis. It's connected to ArcGIS Online, our cloud-based software as a service kind of platform. And you can do quite a bit of mapping and analysis within ArcGIS Online or pull in your work from desktop software. But the really important part of this setup is the connection between ArcGIS Online and hundreds of apps and mobile tools. Everything is interconnected so that you can collect data and then it's automatically populated in a dashboard, or you can create interactive data stories with story maps. The interoperability of this platform is really what makes it so useful. So let's start talking about those uses, shall we? I'll begin with some examples of problem identification and situational awareness. And of course, just for you, I'll start with Texas. In 2020, the public health professionals in Harris County wanted to understand if their residents had adequate access to COVID-19 testing sites. So, similar to the idea of food deserts, their analysis detected testing deserts in their community, and that knowledge made it much easier to quickly respond and improve testing availability in just the right places. And I find this example pretty shocking. And because I'm shocked, I'm going to get a little bit of water. Now, I authored this story in the form of a story map. If you're not familiar, it's an interactive set of graphics and maps that has narratives to describe a problem or a situation. And in this case, I was writing about mental health in America. And in the upper left, you can see a representation of the number of poor mental health days by county in 2015. The data came from the Robert Wood Johnson Foundation's County Health Rankings dataset. And then in the lower right, we used the same resource to show the number of poor mental health days in 2019. 5 years. It's pretty distressing, right? I mean, clearly we have a rapidly developing mental health crisis across the country. And by the way, I did include a link to the rest of the story on a PDF version of these slides, which I'm happy to provide in case anybody would like to have that. Okay, here is another one. The W.K. Kellogg Foundation used a geographic approach to assess Black women's access to healthcare in New Orleans. What you're seeing here are higher numbers of Black women of childbearing age in the darker red census tracts. The hospital marker that you can see there in black, that one has no birthing facilities at all. And then the hospital in blue doesn't even have a NICU. Green hospitals have a NICU, and those that have the yellow star also have baby-friendly designations. You can see there is a clear access disparity here. Let's talk about situational awareness during an emergency. I mean, it's pretty clear that people chose to get their pandemic-related situational awareness from mapped data. I'm sure you all recognize the Johns Hopkins University dashboard, which was by far the most viral map-based application in history. It literally received hundreds of billions of views, and that dashboard accomplished a lot in 3+ years. In a very real way, I would say it kind of got the ball rolling, reminding the world about the value of GIS for health. And because the data was completely open, it promoted data sharing and innovation. At the same time, just by virtue of its existence, it did kind of expose gaps in public health data collection that are already being targeted to be addressed as we move forward. And because of the near real-time updates, people, much to maybe our chagrin, developed a new expectation for real-time data that they never really had before for health data. Now, again, because of the open data sharing, others could simply consume the JHU data and create thousands of similar dashboards that provided very localized situational awareness. And this has probably been the most valuable open data set ever created. Now, of course, situational awareness went well beyond the display of cases and deaths from the JHU data. The Africa CDC, for example, shared information around the vaccine delivery, vaccine brands that were being used, and the variants of concern. And wastewater testing has been shown to be an efficient way to sample hundreds, thousands, or even millions of people in an area. And I know you know this, but as a passive system, this process is literally out of sight, out of mind with each flush. I mean, not only is it convenient and non-obtrusive, But it's also pretty equitable and inclusive since everyone served by a sewer shed participates. Now, this surveillance method detects virus, whether an individual is symptomatic or not. And because of faster and better pathogen detection, there's more time for public health officials to make decisions, to provide needed resources in the right places, and to communicate risk. I mean, GIS not only supports the visualization of wastewater testing results, but also helps determinations of where to test in consideration of upstream and downstream factors in this technology. Now, one very comprehensive way to identify problems is to perform a community health assessment. And GIS can support the entire effort with some pre-configured solutions. You can deploy one solution that enables your organization to perform community health assessments based on the CASPER. Excuse me. CASPER, as you know, is the Community Assessment for Public Health Emergency Response. It's a framework using smart surveys and dashboards to modernize the whole data capture and visualization process. You can also use a health resource inventory to collect community assets and then share those resources with the population through apps and community partners to make sure that everyone gets connected that needs to be. And I'm happy to share that Tracy Haywood, who is a fellow Texan from the City of Austin Public Health, well, she was an integral part of the team that informed the development of this solution. And actually, she and her team presented on their deployment of the GIS-based CASPER just a few months ago at the Esri user conference. So I wanted to share a few images that came from their work and their slides. Now, there are hundreds of ways that we can identify problems and represent situational awareness spatially. Often our next step is going to be to perform some kind of analysis to learn more, to characterize root causes, and to expand our understanding of a challenge or an inequity. And of course, if we're going to do a great analysis, we need great data. And so I just thought I would mention one data innovation that we saw during the pandemic, which was anonymized and aggregated cell phone data. And this data could reveal social distancing behaviors and even show the visitation rates for businesses like grocery stores or gas stations or home improvement stores. I mean, this is how we knew that people were doing a lot of home renovation projects during the initial lockdowns. These data provided great insight into human behavior that was useful for guidance and policy making. And let me show you just a few examples of how this data was deployed. Now, here's an analytical application that I just love that looks at social distancing and weather. So what you're seeing are social distancing grades over time in California by county, where red is an F grade, no social distancing, and blue is an A grade. So we look at this over time, and now we put in the date that the California stay-at-home orders went into effect. Obviously, before that, there was no social distancing, so everybody got Fs. But interestingly, the coastal counties did much better with social distancing than some of our inland counties. But then something happened toward the end of April, and we'll put another time slice in there in just a moment. Here it comes. People started going to the beach. They weren't supposed to yet. Lockdowns were not lifted. So what was happening? Well, we thought it might have something to do with the weather getting warmer, so you can start to layer in more data. So we put in data from NOAA, and we built it up over time in what we call a voxel layer, which is really just volume plus a pixel as a voxel. And now you can start to see those areas in the orange-brown color that were much warmer. And then you've got, of course, blues and greens for the cooler temperatures. Now we can do a face-to-face comparison with social distancing over time and place and warmer temperatures. So I'm going to zero in on San Bernardino County. That's where Esri headquarters is. And there is a very strong correlation between abandoning social distancing when the weather gets hotter. But I promise you, it was not Esri employees. They were all helping our customers with pandemic response. Now, another way that social distancing data or that anonymized cell phone data was used was in compartmental models, which, as you know, are meant to predict how an infection will spread. Then that prediction is often used to forecast the impact on the local healthcare system. Now, before the COVID-19 pandemic, compartmental models were built as global models, meaning you had one single equation to explain hospital surge across a geographic region. Esri spatial statisticians added GIS methods in 2020 so that analysts could account for spatial variability in the data for parameters like local differences in social distancing behaviors, individual hospital capacity numbers, and so on. And this was really valuable because then you could do scenario testing to see whether specific areas may need to apply more strict social distancing guidelines, or you could test to see what would happen if social distancing policies were relaxed. And I have to warn you, it is very possible that I'm going to start coughing during this presentation. I've been talking so much. I just have a weak voice. I don't know why. Okay. Well, in addition to this, the results of compartmental models can help us plan ahead to create more capacity when that's going to be needed. The Army Corps of Engineers did this. They used GIS for the entire process, from reviewing multiple compartmental models as an ensemble, to prioritizing the list of potential candidate locations, to then inspecting them across several measures for quality and resource availability. And like the Army Corps of Engineers expanding healthcare capacity, there were many other ways that the pandemic required an expansion of services. You all know that. And I wanted to show you a tool that we built to simplify the workflow of expanding vaccine distribution sites in an equitable way. So very briefly, here's how it works. First, we map the existing vaccine clinics. Then we input an accessibility metric. It could be a 15-minute walk time or maybe a 20-minute drive time. And from there, we do our first run and it'll tell us how much of the underlying population currently has good geographic access to a vaccination site. Then obviously, you got to work to fill in the gaps. You want everybody to have good access. That begins with collecting and mapping all of the possible candidate locations for new vaccination clinics. Then we want to add our equity factors that we think are relevant for this community. You can add as many factors as you want. In this case, it's got the CDC Social Vulnerability Index, but there are many more vulnerabilities, particularly ones specific to COVID-19. For example, some people have increased susceptibility to severe disease, so we can map where there are high numbers or percentages of people over 65. Others might experience factors that put them in a position to be more exposed to disease, like through their jobs or their living situations. Well, we can map service occupation prevalence and nursing homes and dormitories and the like. We can also include and map socioeconomic risks like race, lack of vehicle ownership, language, clean water availability for hygiene, or a host of other relevant indicators of vulnerability. So whatever you pick, as many as you want, in the end, we return from the analysis the fewest number of new vaccination sites, save money, that would close the geographic gaps, keep access reasonable, while favoring the most vulnerable areas, ensuring equity. Okay, total change of pace. Another kind of interesting example is using GIS for contact tracing. Now, with GIS software, you can do link analysis to get a better understanding of the person-to-person connections that are, of course, the traditional focus of contact tracing. But then there's a twist to the traditional methods. When you've connected or collected location data and you add in tools from graph theory like centrality, you can determine the strength of person-to-person to place connections. And that is particularly important in the situation that we had with widespread community transmission of disease. You can get a lot more insight from a map than a spreadsheet, in this case, noting cases in red and contacts in gray. You could look at transmission on a heat map where, in this case, that bright yellow spot is a nursing home. And in the lower right, you can start to hone in on cases and popular places in the community using, again, that anonymized cell phone data to see visitation rates across all kinds of locales. Well, oftentimes we want to assess problems related to access to healthcare and health promoting services. And over the next few slides, I want to show you a few ways to think about calculating access. Now, I have to say, traditional calculations of access used Euclidean or straight line distance measurements to understand, like a patient's access to their provider, for example. Often, for the sake of simplicity, that was calculated from the patient's zip code centroid. Problem with that, it's just not accurate. People rarely live right in the middle of their zip code, right? So with this method, you risk masking access disparities. But here's another issue. Who actually travels in a straight line, right? What we need is geographic context to truly understand access, and better still is to include speed limit data and common traffic patterns to supplement those travel distances with very accurate travel times. And when we do these calculations, we can represent access for entire populations of patients to their providers or the local health promoting services with spider diagrams, as you're seeing here. These can offer a high-level view of patient or consumer access. And we can also look at access from an institutional kind of perspective. So let's say this is a WIC center with 15, 30, and 45-minute drive time service areas. Maybe we want to improve WIC services based on accommodation, meaning that the organization can accommodate a client's needs, such as providing easy to use appointment systems, walk-in facilities, days with longer hours of operations, and culturally and linguistically competent care. Well, in this case, we've enriched the 45-minute drive time to that service area to have data on neighborhoods that have the lowest levels of English language proficiency. So this kind of information could really help improve access to those services based on language accommodation. Well, through analysis, hopefully I've shown you how we locate new resources or develop deeper understanding of an issue. Now the question is, how do you get people engaged? Connecting them with new resources or sharing relevant information with them, or even changing their behaviors. Well, of course, GIS can help with that too. One example that I love of community engagement happened in Cobb County, Georgia. Now, early in the pandemic, I'm sure you all recall, grocery and supply stores were emptied of critical staples. People often had to travel far and wide to get toilet paper, milk, and other products. So the county created a GIS-based grocery store survey where citizens could crowdsource reports about what was available and where. And this became very popular with almost 500,000 views of the real-time dashboard in just the first 2 months. A very common way that governments communicated with residents was through initiative-based hub sites. In fact, they were so common for vaccine outreach that we developed a template that health departments could implement quickly and just adapt for their own information delivery about the vaccination process. Now, included in the hub solution was the I Got Vaccinated story map. And this is a publicly facing story map that was highlighting community members who chose to be inoculated. So this one's me, and I added my story, like hundreds of others, as a way to encourage those who were on the fence about getting the vaccine. And we saw a big increase in vaccine locator apps. So these apps to help people find the vaccine brand they wanted at the time and the place that they wanted to receive them. And while most people were able to find their way to a vaccine if they wanted it, some people needed services to be brought to them, like those that are homebound, healthcare dependent, or those who don't have a vehicle. So there are several ways to identify who should be offered home vaccination services. I've listed a few of them here, and some health departments even had a simple survey that allowed people to opt in for home vaccination. Now, all of that outreach data had inputs that would feed into a dashboard like this one, so that call center staff could reach out and ask who wanted to be vaccinated at home. And all the work is done within the dashboard. To the right, you can see there's a script for the call and a data input form. And as information is acquired, real-time updates show who's interested in having a home visit to get their shot. Then GIS is further deployed to optimize the routing for the mobile vaccinator team, and that helped them to better manage their time and resources while also being able to match them on patient preferences, like maybe language capabilities. And we could give patients reliable visit time estimates. And while it's not shown here, we also created an app so that mobile vaccinators could record the vaccine information upon administration so it could feed back into the immunization information system. And this is something that Clackamas County, Oregon did, and they actually won a prize from NACCHO for this. And they said it saved them about 50% of the estimated time to get their work done. Well, for this whole process, the information can be reflected in an operational kind of dashboard that shows the progress of the workflow and key performance indicators so that decision makers can make any adjustments whenever they're needed. Now, geography actually supports another kind of communication and engagement, and this time, let's think about boosting vaccine confidence. When you combine information on attitudes, maybe research data, lifestyle information, and the channels through which people like to get their information, you can target messaging to what people need to hear. Now, the US Census Bureau actually did this to improve the population count for 2020. They began by using data to predict the places where, in America, where people were less likely to complete their response by mail form. And then they created a map that was enriched with deeper information about known demographics, lifestyles, behaviors, and preferences. So they could pinpoint communities like Phoenix, Arizona, that clearly needed messaging in Spanish to increase the completion rate. In Kingston, New York, they promoted census participation as a civic responsibility that would translate into federal dollars, allowing their local government to provide more services. So each method was tailored to the specific needs of a location. And in a very similar way, the CDC took on an exploratory program to increase vaccine confidence, providing the same kind of data and mapping tools to local governments. Maybe you used them. Now, at this point, I want to dive into the idea of evaluation, since it's so important to ensure that we get the return on our investment and our effort in the way that we were looking for. Now, this first example of evaluation comes from Milwaukee County, Wisconsin. They combined their data on vaccination rates for COVID-19 vaccines with the CDC's Social Vulnerability Index to identify whether vaccine distribution and uptake was equitable. Now, they called their model EVE, which is short for Evaluating Vulnerability and Equity. And by combining the two data sets, we basically have a 2x2 table, and that helped us to really understand what's going on. So take a look at the orange quadrant. This is where vaccination rates are low and social vulnerability is high. So the goal for Milwaukee County in this case was to turn orange census tracts to green ones, ensuring that vaccinations were going to those most vulnerable. So here's how they did. They began with a lot of orange in their county, and after 14 months of effort, they made significant progress. And they've been so inspired by the progress with this simple method that they're applying EVE to other key issues in the county, like opioid harm reduction programs, gun violence, and 911 emergency response times. In fact, I was just on the phone with their health officer last night. So map-based dashboards really offer a great way to track any of your key performance indicators. This one's financial. How's money spent? Where is it spent? Who's benefiting? Those are important metrics. And there are even different kinds of dashboards. Maybe they don't have maps. They can answer questions like, do your workforce and volunteers compare appropriately with the community at large? Can GIS, or actually I should say GIS can support not only your community-based health equity plans, but with these kinds of dashboards, they kind of also support your internal organizational diversity, equity, and inclusion policies. So take a breath. I've covered a lot of ground today, defining GIS, walking through a health equity framework to providing examples of applied GIS for public health workflows. And I hope I've convinced you that this technology is more than a map. It truly is, I believe in my heart, a mission-critical system for your work. Now, I did promise you a few resources for today. Definitely look at our Racial Equity GIS Hub. This hub site has free data, maps, apps, and information on best practices for making progress on racial equity. And let me be honest here, it may be focused on the topic of racism and social justice, but most of the same workflows are 100% relevant for health equity. I would also encourage you to look at our Health and Human Services website and its focus areas. One of them is health equity, but we also have public health preparedness and response, things related to the opioid epidemic, to homelessness, strategic planning, and access to care. You'll see lots of examples there. Maybe they'll provide additional inspiration for using GIS. And most importantly, I've added a link to a free Health GIS curriculum that I helped to build. It's a self-paced set of tutorials. They're based on real-world problems, and they're basically meant to build your skills in various GIS tools that are the most relevant ones for the health industry. And shameless plug, but maybe you'll be interested in my book. It tells many more stories about how GIS was used to support all aspects of pandemic response and community resilience. So I want to invite you all to email me. You can follow me on social media to stay up to date on what's new in GIS for public health. And at this point, I am happy to take questions.
Thank you so much. That was really great. Very interesting. We have a couple of questions that I think okay. Someone was asking, they wanted to connect with you from a local health department, but you gave your email address, so that answers that question. Someone asked about resource links, but you kindly provided those. And just to remind our participants that this was recorded, it will be posted on our YouTube channel, but check TEPHI.texas.gov for the link, and also we'll be sending it out in a couple of days. There was a question.
Let me mention that, just since I breezed by it very quickly, my email address is eGarrity, G-E-R-A-G-H-T-Y @esri.com. And for the resources, the person who asked about that, like I said, I'm happy to send a PDF of these slides so that you have links to everything I linked in there.
There was a question about that shocking data about mental health days, and that was before the pandemic. And the question is, were the increases that we're seeing between 2015 and 2019 confounded by increased awareness or insight into mental health? That is, did someone actually have some mental health issues in 2015, but it was underreported, but was reported in 2019?
So I certainly would say that's possible. I mean, this is the Robert Wood Johnson Foundation County Health Rankings data. So I have no control over the data set. I'm simply showing what's there. And I would say maybe that's so. I mean, thinking back, how much of a change in taboos, for example, over mental health have we had in just that 5-year period? I don't know if it was enough to see that difference. We went from something like 36 counties that had quite significant numbers of poor mental health days to over 1,300. So I don't think it accounts for all of the change, although maybe it accounts for some of it.
There is a question. I'm going to read you 3 of them because they're sort of linked. For those of us working on shoestring budgets, she is probably at a local health department. Are there accessible Esri products for government public health workforce? And a recommendation on GIS software to start with. You did an amazing job. And wait, there was one other. Oh, somebody asked about a demonstration of ArcGIS. Well, I'll let you answer. I'm not going to answer for you.
Sure. I'll start with the demonstration. Of course, if you have a specific need and we have solution engineers and account managers who can get with you, you can invite a whole team. We can come to you or do it online and give you a demonstration of something specific to your needs. So that's no problem. You can email me and I'll connect you. Or you can also just email healthinfo@esri.com. As for where to start in public health with GIS, first of all, we have all sorts of programs to make the software more affordable. ArcGIS Online, to have one seat, one license of ArcGIS Online, it's not that expensive. I mean, it's like $500. So this is not crazy expensive software. I mean, if you get into enterprise systems and try and enable the whole organization, it can get more expensive, but for local governments, we have what we call a small government enterprise agreement that's discounted. So you just have to talk to somebody to kind of figure out what your needs are and what's the best option. But I will say that, I was showing you that one technical diagram with ArcGIS Online and all the web apps and everything. I would say if you wanted to get the biggest bang for your buck, start with ArcGIS Online. Make some, I mean, you can make detailed maps too, but simpler maps do create public surveys, create dashboards, create story maps. You can create hub sites. All of that stuff is available in ArcGIS Online. Then if you want to get into more detailed or deep analysis, or you want to work with more sensitive data, then you may have to get a desktop license, ArcGIS Pro, and that's where you have all of the super powerful analytical tools. And then if your organization grows, you might get an enterprise agreement. And I will tell you that there are small government organizations like the city of Bethlehem, for example, that they used some of their pandemic money to buy 3 years in advance of software and services so that they would be set for a while. And we call them our zero to hero story, because they didn't know anything about it and then they just sort of ramped up pretty quickly. So, but that's where I would start, ArcGIS Online.
Could you, first of all, an easy one, could you repeat your email?
Yes. Basically my first initial E and my last name Garrity, GERAGHTY, at esri.com.
Thank you. A question about using GIS mapping to focus on people who are incarcerated through a health equity lens.
Yeah, there was one of our customers was working on doing that. A couple of different things going on. There's a whole recidivism program that we were collaborating with Salesforce? No, not Salesforce, SAP on. But Loma Linda University Health and the County of Riverside were working on a recidivism program. And basically the thing that comes to mind for me, and one way to easily start to support this community, is with resource locators. I mean, I showed the one from New York City for people finding vaccine resources, but those resource locators can be for anything. And so I would think for those who are incarcerated or paroled, especially when they're paroled, getting resources to housing and job opportunities and any kinds of social support would be very useful. So that's what I would focus on, is connecting people to the resources first. And that would be my first biggest idea. I mean, I don't know how long people who are paroled are tracked, but it might be interesting to map the neighborhoods they're in. I'm just not sure yet what the action would be if you do that.
Thank you. An easy question again, is ArcGIS Online HIPAA compliant?
That is a great question. So that's why I said if you're going to use sensitive health data, you might want to go to ArcGIS Pro. It is, we have just achieved FedRAMP moderate status. And when I was in public health, I didn't know anything about FedRAMP. So maybe it means nothing to you. But what I can tell you is that FedRAMP moderate is very close to HIPAA compliant, but they're not identical. So there are a few additional things that are required to be HIPAA compliant. And it also, of course, requires things on the user side, the way that you treat passwords and your screen privacy and all of that. you know it's about people, process, and technology. What we do have available in ArcGIS Online, but it still requires a desktop license, is we've been able to make the geocoding process HIPAA compliant. So as an example, you could have a private individual level data set with personal home addresses on it on your private computer, your desktop software, and it is connected in the cloud to ArcGIS Online. And you could send that information up, have it geocoded, and then it's pulled right back down to your computer. That process is HIPAA compliant. We are working, and within the next year, I don't promise dates anymore, I've learned not to do that. We actually will be able to say that ArcGIS Online is HIPAA compliant. For many, they're comfortable enough, but you know, I personally would wait until you have the sign off. By the way, we do have a site that is trust.arcgis.com. You could follow that site and it will be updated with all of our HIPAA alignments.
I know we're at time and I know it's midnight where you are, but if you don't mind answering just a couple questions, I know people may have to leave, but this way it will be on the recording because I think these are good questions. One is, what kind of emerging advancements or new applications of GIS for health equity excite you the most?
Oh gosh, well, I would be excited if people just used the current technology to its fullest extent, but there is a new technology, and I don't yet know how it might be used for health equity, but it has so much potential in health. It's called ArcGIS Knowledge, and it is like an integrator of multiple different kinds of data sets, including unstructured data. And it does things like, the only way that I can explain it really well is with supply chain. So like imagine there's a foodborne disease outbreak and you want to be able to trace through multiple different layers of things what's going on. I mean, I think of health equity as a multi-layered, complex, multi-stakeholder problem. And so I'm thinking maybe ArcGIS Knowledge is going to be a way. It sort of pulls in graph theory and link analysis and all of these different things. So maybe that's it. And we're still thinking a lot about how we want to enable GeoAI. I think there's a lot of potential for that kind of technology, but right now, most of what we're saying is artificial intelligence is really more along the lines of machine learning and deeper kinds of cluster analysis tools and change point detection and prediction models. So you may be familiar with those and not be as excited about them, but look at ArcGIS Knowledge and see what it can do.
Thank you. For zoonotic infectious diseases like TB, would GIS be useful in mapping cases of TB strains in both humans and animals?
I would think so. I mean, I think GIS was basically made for One Health, right? I mean, it's, I always go back to my epi training and the epi triad, and isn't One Health basically the epi triad? And
Yep.
And isn't GIS meant to look at people and places and animals and their interconnections, right? So yes, I think that you could use GIS to put all of those things together to gain a better understanding of what's transmitting, how, where, why. Yeah, it's perfect for that.
Yeah, and I will put in a little plug here for our mini course on One Health if you're interested in learning more. It should be ready up in a couple of weeks. And then the last one, has there been mapping of the current triple threat of RSV, flu, and COVID-19 and the impact on healthcare visits and hospital visits?
There have been, I don't know if I would say mapping of RSV flu.
We aren't seeing a lot of cases yet.
Yeah, I've seen a lot of separate things. Like I've seen sort of they're really mostly separated. I've read a number of articles, and not this year, but previous years, even just with seasonal influenza, and how it's difficult to discern from COVID and what it all means. And And then even other things, this may be off topic, but you got me thinking about One Health. And so then I got, my mind just goes nuts. I was thinking about environments and drought and warming environments and dust and
Flooding.
valley fever, and you can mix up valley fever and COVID, and if you do and you give the wrong treatment, you make it worse. So yes, we need those kinds of analyses, and I think mapped information is part of it, but I think there's probably going to be more to it as well.
Yeah, and you have to have the data. And like you said, it, with flu, ILI, it's difficult to tell sometimes what the causative agent is.
It is, and I'll just
Yeah.
mention, if anybody doesn't know about it, there is the Walgreens Flu Index, and they have this online, and they do it every flu season. And while it's not confirmed cases of flu, it's actually prescriptions for Tamiflu and other flu-related products. And they tend to be pretty close to CDC actual cases, and they're usually a couple weeks earlier. So
Yeah.
might want to look up the Walgreens Flu Index.
All right. Thank you so much. I think you're going to be hearing from a number of people, and a lots of kudos in the Q&A in the chat. I'm not sure if you can see it or not, but thank you so much. This was really informative. And our next Grand Rounds will be on November 8th. We'll be talking about Chagas disease. So hope to see you all then.
Bye.
Bye.